Healthcare Team LGBTQ Affirmation Training. Class is in session. Before we get started, anytime you see this heart appear and hear this sound, look for a citation in the references. Hello, my name is Professor Hippocrates Nightingale. Welcome to Affirmation Training 101. Let's get started. Follow me, class is about to begin. Lesson 1. Who are LGBTQ people? They are all ages, races, and ethnicities. However, every LGBTQ person is unique. What they all have in common is the experience of being sexual and gender minorities. They represent 4.5 to 17% of the US population, with younger people more likely to openly identify as LGBTQ than older generations. The lesbian, gay, bisexual, transgender, and queer community is very diverse, and it is important to keep in mind that the term LGBTQ does not fully encompass all aspects of sexual orientation and gender identity. However, it is currently the most widely used term to describe those who are not cisgender and/or straight. We have tried to include as many perspectives as possible, and we understand some voices may be misrepresented or missing. We are sorry, and we are still learning. Sexuality, gender, sexual orientation, and anatomy are independently fluid pieces of our human identity. There are many tools which attempt to explain the nuances of gender and sexual orientation. One of these tools is the gender unicorn. It is a visual representation of how each of us have various ways in which we express our gender and sexuality. How one understands and defines these factors over their lifetime may continually grow. On the diagram, the terms other, or other genders, are used to indicate the many genders which people might identify as, express themselves as, or be attracted to outside the binary options. Also, notice how there are 3 arrows under the main headings. This allows you to adjust your response in a very diverse way. Think of it like rating each item on a scale from 0 to 10. It is like someone asked you if you like tacos, pizza, or hamburgers, but you were able to score how much you liked each one on a sliding scale. The top row is gender identity. It is how you internally experience and define your gender based on how much you align, or don't align, with what you understand the options to be. You can think of gender identity as who you know yourself to be on the inside, or how you see you. Next is gender expression. This is how you externally express gender, through actions, clothing, demeanor, etc., and how those presentations are viewed based on social expectations. Think of gender expression as what you present on the outside, or how you present you. The third row is sex assigned at birth, which is the anatomical sex assigned to an infant. This is what was decided when you came out kicking and screaming, and someone took a look between your legs. If we look at sex in a bit broader definition, it refers to organs, hormones, chromosomes, and other pieces of anatomy. Being intersex can be any combination of what I just described, and occurs in 1 in every 100 births. When your interpretation of gender matches the gender roles that society expects of you based on your sex assigned at birth, then you are considered cisgender. And when those do not match up, you are considered transgender, non-binary, or genderqueer. Let's go over a couple of important terms. Transgender woman is a person assigned male at birth who identifies as a woman, girl, female, or feminine. Transgender man. Someone assigned female at birth who identifies as a man, boy, male, or masculine. Before we move on to the next portion of the gender unicorn, it is important to understand that gender identity, sexual orientation, and gender expression are independent of one another. One does not decide the other. The next 2 rows of the gender unicorn are sexual orientation, which refers to who we are physically and/or emotionally attracted to. Physical attraction includes who you are sexually attracted to, while emotional attraction includes who you are romantically attracted to. We often think of sexual orientation as being pretty simple, such as straight, lesbian, gay, bisexual. However, it is not necessarily so cut and dry. For example, asexual people often desire to have emotional connections, but may not have any sexual desire. The gender unicorn really allows us to show how we are each different. Assuming each option is 0 through 10, then there are over 9 trillion different possible combinations. We are all truly unique. Remember, the gender unicorn is descriptive, not prescriptive. It is not a diagnostic tool. You cannot diagnose someone as queer by using this unicorn. Some key points are: terms differ among cultures, terms change often, Stay current. If you don't know a term, don't be afraid to ask, and mirror terms patients use themselves. An example of terms changing over time and mirroring the terms your patients use is the word queer. Older patients may find this word offensive, while the younger generation has reclaimed it. Queer is an umbrella term, used when one's sexual or gender identity does not correspond to the ideas established by the heteronormative world. Gender affirmation refers to the range of actions that individuals undergo to live and thrive as their authentic selves. It looks different for everyone, and may be social, legal, or medical. Social affirmation might not be something that happens across every aspect of a person's life. They may have to be one version of themselves with close friends, and another at family gatherings, or in work settings. Examples include telling people the pronouns you use or making your hair, mannerisms, and clothes match how you define your gender. Legal affirmation is pretty straightforward. It includes things like changing your name, getting a new gender marker on your driver's license, and other examples that likely require a trip to the courthouse. Medical affirmation is a bit less straightforward, and not everyone that does not identify as cisgender takes this route. Taking hormones and surgery fall under this category. Before we go any further, let's do a quick review of what we learned in the previous video about how minority stress leads to increased health disparities. Remember, LGBTQ people live in a heteronormative world, and this world holds harmful ideas, does harmful actions, and creates harmful regulations toward the LGBTQ community. LGBTQ people feel the full weight of living in this world. This cumulative burden is known as minority stress. Being part of the LGBTQ population does not cause an increase in negative health outcomes. Rather, the lifelong stress load weighted down by stigma, prejudice, and discrimination does. Minority stress leads to increased health disparities such as increased rates of drug and alcohol abuse, increased rates of tobacco use, increased rates of obesity, increased rates of cardiovascular disease, and decreased rates of preventative services and screenings. Lesson 2 is promoting health equity. What can we as healthcare professionals do to address health disparities? If I am reluctant to seek healthcare, but see an affirming sign, it would let me know I'm welcome there, and can be my true self. So, step 1 of promoting health equity is to create a welcoming and affirming atmosphere for all of our patients. This can be done by hanging supportive posters and having affirming literature. Step 2 is patient interaction, or to be more precise, it is interacting with patients in ways that do not make assumptions about sexual orientation or gender. Making assumptions fractures patient, provider trust, and may contribute to minority stress. A vital way to improve patient interaction is by using the correct name and pronouns of your patient. To do otherwise is referred to as dead naming. You may mess up. However, making an effort indicates respect and builds trust. Let's cover a few examples of negative versus more inclusive patient interactions. Instead of "do you have a wife or girlfriend?" we could ask, "Are you in a relationship?" Here's another example. Instead of, "Hello Mr. Smith, what can I do for you today?" we could say, "Hello, my name is Dr. Stevens, what is your name?" By speaking in ways that do not convey assumptions or judgments, we can help create an affirming environment. If you make a mistake while addressing someone, apologize but don't overdo it. The third step in promoting health equity is using inclusive forms. Healthcare teams use experience and wisdom to make clinical decisions, but rely on the accuracy of electronic health records to inform those decisions. In order for electronic health records to reflect accurate information, both SOGI and anatomical inventories must be reported. SOGI stands for sexual orientation and gender identity. We covered this in length previously. An anatomical inventory is a checklist of organs and surgeries that allows healthcare teams to provide patient-centered care tailored to each patient. For example, it may ask about the history of mastectomy or hysterectomy, or the presence or absence of testicles or a prostate. Collection of anatomical inventories is important for all patients, no matter their gender. An example of not collecting SOGI and anatomical indexing properly, which would lead to a negative interaction, would be a provider entering an exam room and stating, "Hello, Mr. Smith. I'm a bit confused because my chart says you are here for a cervical cancer screening. To prevent this from occurring, the electronic health record should have alerted the provider that the patient had socially transitioned and retains a cervix. The next step of improving health equity is knowing where to refer patients with needs beyond your clinic. Here are a few national organizations. The LGBT National Hotline provides a safe environment for people of all ages to discuss issues they don't feel comfortable talking about anywhere else. The Trans Lifeline provides trans peer support to their community. They're run by and for trans people. The Trevor Project provides information, support, and crisis intervention to LGBTQ young people via chat, message, and phone support. The National LGBTQIA+ Health Education Center provides education, resources, and consultation to healthcare teams. They are part of the Fenway Institute, one of the world's largest health centers focused on LGBTQIA+ communities. Folks Health provides virtual healthcare for queer and trans individuals, including prescriptions and mental and physical health. Pride Counseling provides professional therapy for the LGBTQ community via phone, internet, or video. The Safe Zone Project is a free online resource for powerful, effective LGBTQ awareness and ally training workshops. The Human Rights Campaign envisions a world where every member of the LGBTQ+ family has the freedom to live their truth without fear, and with equality under the law. They empower supporters to mobilize against attacks on the most marginalized people in our community. And it is up to the healthcare team to find other LGBTQ-friendly resources in your local area. We covered a lot of information in class today. Lesson 1 covered who LGBTQ people are, the gender unicorn, and a review of minority stress. Lesson 2 discussed improving health equity through creating a welcoming atmosphere, improving patient interactions, using inclusive forms, and knowing available LGBTQ resources. If you made it all the way to the end, you are doing the hard work needed to create a more equitable, safe, and inclusive world. We all have the ability to make it better. Thank you for taking time to educate yourself about new things. You are a hero.